Hi, welcome back to the Beauty Authority. I'm Tatiana Bito, Director of Aesthetic Content for New Beauty. And today I'm with West Palm Beach dermatologist, Dr. Jacob Beer. And we are talking about something that everyone is talking about right now, which is GLP-1 weight loss and the aesthetic concerns that come with that rapid weight loss. Hi, Dr. Beer. How are you today?
Hi, Tatiana. Thanks so much for having me.
Thank you so much for coming and speaking with New Beauty. Like I said, everyone's talking about this. I'm sure you're seeing a lot of this at your practice. So let's start off with not Ozempic face, but hair loss. That's a big one. So, why, when you're losing weight on a GLP-1, are you also sometimes losing hair or seeing hair thinning?
It's really interesting because a lot of even dermatologists can kind of just chalk it up to a shedding process called telogen effluvium. So if you look at the hair cycle, there's different cycles. And so in periods of rapid weight loss or illness, or sometimes when we see these kind of diet fads, you see patients lose a lot of hair after they've lost weight after a few months. So a lot of people think that it's solely that. When you delve into it a little bit more, there's more intricacies and more nuance. So the first thing that we can see is sometimes that shedding unmasks an underlying androgenetic alopecia or pattern hair loss. Now, this is typically in the central part and it's more kind of thinning. So you see the shedding that unmasks the thinning. The second aspect is what's called a chronic telogen effluvium. This is where that process of shedding gets started and it just continues and continues and continues. Now, usually it kind of resolves on its own, once the weight stabilizes, but in some cases it does just continue shedding. So those are the two main ones. Within that, there's also kind of vitamin deficiencies that could play a role in hair loss as well. So predominantly vitamin D deficiency, very infrequently biotin deficiency, and then zinc deficiency. So I would say vitamin D and zinc deficiencies are the biggest ones I see in patients with Ozempic.
So basically, what you're saying is it could either the weight loss itself could trigger or, you know, an underlying issue that you've already have can now be exposed more because your body is reacting to the weight loss.
Exactly. So it could be one or both of
Right.
those main processes.
And then if you're not getting the right nutrients, then you're automatically, most people are going to be in that third category too.
Yes, exactly. So I mean, the one of the biggest issues when patients are on Ozempic is obviously loss of appetite, which is good and bad. So you lose weight, but you might not necessarily be eating the right sorts of foods. So a lot of nutritionists and dietitians will recommend having protein, which is helpful overall, but also helpful from a hair perspective because a lot of kind of red meat, chicken, a lot of things that have protein also have zinc. So it's also helpful to make sure that you don't have a zinc deficiency as well.
So, what are some ways that if you are on a GLP-1, you can either be proactive or actively start treating this concern?
That's a great question. And I mean, it depends on how aggressive patients want to be and how aggressive they can be. So, my rule of thumb for a lot of my patients is as soon as they start losing hair, then I like to be as aggressive as possible, as quickly as possible, because it's really hard to regrow hair. And it's much easier and simpler to kind of maintain the hair you have and then add to that. So, I
Yeah.
kind of put it into different buckets. The first one is kind of the realm of nutraceuticals and over the counter products. You can think of things along the lines of Extrese or Nutrafol or Viviscal, anything like that. Moving from there, I think of topicals. So these are things like Rogaine, topical minoxidil, topical finasteride, topical dutasteride, medicated or over the counter topicals that should be used regularly. From there are pills. So the main ones are minoxidil, which was originally a blood pressure medicine and kind of just helps increase blood flow to the follicle, but comes with its own side effects. And then the other kind of category is then also finasteride and dutasteride, which work very well as well. Beyond that are the procedures of the interventions. And within that, there's a whole variety. But the main ones are PRP injections, which um, ne- it's important to make sure that patients go to someone who kind of recognizes the intricacies of hair biology and make sure they're targeting the right area when they're doing the PRP injections. But that's a series of treatments. The other one is called mesotherapy, and that's
Mhm.
taking those other medicines and then injecting those into the scalp.
Going back to the PRP point,
Yeah.
what could be the incorrect way to inject that some people might be experiencing?
It's very interesting because a lot of even dermatologists are kind of taught to inject the scalp in ways that are helpful for autoimmune causes of hair loss. So the big one is alopecia areata. And so for there, a lot of the inflammation is at the bottom of the follicle. And that's about 4 or so millimeters beneath the skin, 4 to 5 ish millimeters. Where you really want to hit is more towards the top of the follicle, and that's where the stem cells are, and that's where what's called the bulge is that has the stem cells. That's what you're trying to activate. So what I see all the time is patients coming in and saying that, our PRP worked really well, and PRP elsewhere didn't work particularly well after XYZ sessions. And the big thing is that I think they're doing it too deep. And so a lot of people are injecting it very deep into the scalp, sometimes even entirely missing the epidermis and dermis, and kind of just injecting it into the fat and the tissue beneath the skin, which is far less helpful than targeted approaches.
And so there's a wide range of solutions or options out there. How do you pair the right solution with your patient?
Another great question. So I think that the nutraceuticals generally are very helpful. I think that, you know, if there's no kind of financial constraints, I would say that almost everyone, as soon as they're starting to lose hair,
We should
should
all be
start.
on one.
Yeah, I
Yeah.
think they're helpful depending on kind of the data that you look at for this specific product. But things that are really helpful independently are things like pumpkin seed oil and a lot of the kind of maritime products, if it's the right one. But a lot of the kind of anti-inflammatory, what's called anti-DHT, which work in a kind of spectrum along the hormone component, those are very helpful. Beyond that, I think that kind of my everyone should do are the nutraceuticals and then the topicals. The topicals have very few side effects. The biggest ones I see are an allergic contact, in which case you can pretty much have the topical made without that preservative, and patients do really well with it. Beyond that, for a lot of patients, I do prescribe the oral medications as well. Dutasteride is a really great medication and has probably the most efficacy among most of the oral medications. And for the right patient who doesn't have a history of things such as breast cancer, family history, or are able to tolerate some of the side effects, especially in men, then I think it's a terrific medication. If they can't, then I think that minoxidil pills are very, very helpful as well. And then beyond that, I think that if a patient is able to kind of tolerate the initial discomfort of the PRP or the mesotherapy, and there's ways that you can mitigate it. So we employ a number of ways to mitigate it in our practice. But if a patient can tolerate that, and again, it's not kind of a financial burden, then I think that PRP is probably the way to go. If that doesn't work, then mesotherapy, and then there's more kind of advanced options as well.
But there's something you can be doing. And so your advice is the nutraceutical and the topical first together.
Yes, I would certainly say those two.
So now on top of hair, one of the first places you really notice that you're losing weight, which is a good thing sometimes, is in your face. But as we've seen all over the media with a lot of GLP-1 patients, there's this phenomenon called Ozempic face, which we know isn't the medication making you look more gaunt, but it is something that happens. You look a little more tired, you might look a little older, especially in younger patients, and you're losing that precious fat that we want to keep in our cheeks. So what is your advice for quote unquote Ozempic face?
I really like getting ahead of it as soon as possible there as well. And I will typically kind of tailor my treatment regimen to the patient based on how much kind of fat in their face they've lost and where exactly. So a lot of patients tend to lose volume in the temples and around the cheeks, particularly kind of the malar and the zygomatic cheek. And that's a combination of factors. You know, past the age of
Yeah.
30, we tend to lose bone in our face, we tend to lose the fat pads, but with this rapid weight loss, it's mostly kind of the fat loss. And so I really like to do something like poly-L lactic acid in a series, and that's more for kind of maintenance. But in the kind of immediate term, I also like to pair it with hyaluronic acid. And that gives a nice combination of kind of results that will work really well and look great initially, and then something that will kind of continue to work in the background.
So the PLLA for layman's is Sculptra, right?
Hmm.
I won't say
Yes,
the actual
that's
name of
fine. Yeah.
but that's Sculptra, and then you would administer that, inject it around the temples?
I would either do Sculptra, or I would do like a kind of very dense hyaluronic acid injectable there, and that lasts for a good amount of time. But it kind of depends on what the patient wants, and I'll
Yeah.
talk about kind of the pros and cons of both. I sometimes have patients that say, "Look, I don't want to come back every month or regularly. I'd rather come back, every 8 to 12 months or every year and a half. So just give me something that I can do for that." In those cases, I'll use more dense hyaluronic acid. But in certain cases, I have patients that say, yeah, I don't really mind coming to the office. I'm around and I want the best kind of outcomes. And I want something that will work very well kind of on a deep level and then also more superficially. So a lot of our patients also have kind of an informal Sculptra glow
Yeah.
once we do the series as well.
And then how do you approach, because everyone's facial anatomy is different. So I would assume that you're not doing the same injections on every GLP-1 patient. How important is it to go to the right provider who knows how to sort of balance your facial features right?
I really think that's crucial. And I see all that. I think I hear from almost every single one of my cosmetic patients daily the phrase, I want to look natural or I don't want to look weird. And that's because, we've all seen cases of filler gone wrong. And one of my dermatology mentors, Dr. Janine Downey, has a quote that I really like, which is bad filler screams and good filler whispers. And
Mm.
so a lot of patients think of that kind of bad filler patient where someone is doing something in a very kind of algorithmic way where, maybe they went to a weekend course and they said you do 1 unit here, 1 unit here. And that doesn't necessarily work for every patient. So I think that's really crucial to go to someone who's going to kind of assess your facial anatomy and give you a very detailed plan as to why they're using each individual product where. And also, providers should be able to outline very kind of nuanced subtleties such as facial asymmetry, which most people have, as well as kind of where the most volume loss is.
And what is your best tip for someone who hasn't been to see an injector, a physician, a dermatologist, and is just sort of, on the fence about doing something? Because for a lot of people, this is the secondary cosmetic concerns are new to them. So they may not have ever gone in to see an injector or ever gone in to see someone for an aesthetic concern that they have. What's your best advice?
Yeah, my best advice is if you're going to see someone and you're kind of apprehensive about, what they're going to do, how good they are, et cetera. Maybe you've heard about them from, a friend or you saw an ad, something along those lines. Something that I think is very helpful is to ask them, about their treatment plan and if that treatment plan will erase or help the concerns that you have. So a lot of providers that kind of show inexperience and show maybe that they're not really going for realistic goals will say that they're going to erase XYZ concern. A lot of experienced providers will not say that. They will say, will soften these lines or will improve this appearance. So I think that's a really good gauge to kind of determine provider's level of experience. And then aside from that, just being able to kind of push the provider a little bit, and they should be able to explain to you in terms that make sense why they're doing a specific procedure, why they're using a specific product, where exactly they're injecting a specific product in your face and at what level. And if they can't do that, then it's probably not the right injector.
So we've talked about the main concerns, hair loss, Ozempic face. There's also the neck. There's also your hands. I mean, I could go on and on. There's so many different areas. What are the most common concerns people come in? Are there other things people are coming in and asking for help with because of their GLP-1 weight loss?
I would say the neck. The neck is kind of one of the top concerns that I hear daily or almost daily. And I think that it's important there to also assess what exactly is going on, especially with a lot of the tightening devices. Patients are kind of under the impression they could get, one device and it's going to fix everything. But usually they required a much more kind of layered approach. And so the way I kind of explain it to patients is if you kind of think of the skin, there's the upper part of the skin, the lower part of the skin, and then there's fat and fascia and muscle below that. You really have to make sure that whoever's treating you is targeting the exact level of concern that will help. So, for example, we do procedures here where we combine different energy based devices, and we do that to target the upper part of the skin and the lower part of the skin to help with pigment, texture, but then also some level of tightening. And then the other thing is to figure out if it's more of a kind of voluminous issue, muscle issue, or texture issue. Because kind of the muscle issue can be addressed really nicely with neuromodulators. The texture issue can be addressed really nicely with some resurfacing lasers and other devices. And then the volume issue, depending on what exactly the patient's concerns are, might be able to be addressed with a little bit of some of the devices, but might also require some level of some sort of filler.
Wonderful. So there are a lot of great options out there to choose from for whatever you're dealing with in terms of your GLP-1 weight loss. Thank you so much, Dr. Beer, for coming and speaking with New Beauty today. This has been great.
Of course. Thanks again for the invite.
Wonderful. Have a great day. Thank you, everyone, for watching.